I yield 2 minutes to the gentlewoman from Wisconsin, Ms. Moore.
Gentlewoman from Wisconsin is recognized for 2 minutes.
Thank you so much, Madam Chair, and thank the gentleman for yielding. I rise as the incoming co-chair of the Congressional Women's Caucus to talk to you a little bit about the impact that repealing this health care law will have on women. As you all may be aware, women are twice as likely to be dependent upon their spouses for health care, and they're less likely than men to have employer-sponsored insurance. As single female heads of households, of course, this has a devastating impact on the entire family when there's no health insurance. Of course, all of us have heard stories from our district about how the repeal of this law will have on women, and I heard such a story just yesterday. Meet Nicole Lipsky. She's 25 years old, working part-time and going to school part-time, but because of the health care law, was able to remain on her dad's insurance. And lucky for her, because just last week, she had an infected pancreas and had to have her gallbladder removed in an emergency surgery, which cost $13,000 that fortunately was covered by her parents' insurance. You know, this law outlaws gender rating. Insurance companies, of course, charge women higher premiums than men for coverage. And it also has a disparate impact on women with respect to pre-existing conditions. When you consider that being a victim of domestic violence is considered a pre-existing condition. Now, you don't have to be a Harvard economist to know that this law is not a job killer. But we do have a Harvard economist to back us up. David Cutler, a professor of applied economics at Harvard, released a study just on January 7th, finding that repealing the health care law would destroy 250,000, you yield 15 seconds?
15 seconds.
250,000 to 400 jobs annually, and many of these jobs will be women's jobs. CNAs, LPNs, X-ray techs, RNs, and the cleaning woman who cleans up the emergency room. This law is a game changer and a lifesaver for women's health and employment opportunities for women. And with that, I yield back.
Gentlewoman's time has expired. The gentleman from California.
Thank you very much, Madam Speaker. This time I'm happy to yield 1 minute to my good friend from Cherryville, North Carolina, Mr. McHenry.
Gentleman from North Carolina is recognized for 1 minute.
I thank the chairman. Thank you, Chairman Dreyer, for yielding. Last night, House Republicans took a major step in our pledge to America by passing a repeal of Obamacare. Now, we must work to replace this budget-busting law with sensible market-based policies that actually lower costs for families and small businesses and expand access to affordable care. Small businesses are the job creators that hold the key to our economic recovery. They cannot afford the hundreds of billions of dollars in new taxes in the Obamacare law and the new employer mandate as well. Our small businesses need certainty in the tax code, certainty in regulations coming out of Washington, and Obamacare only makes matters worse. I look forward to an open and transparent debate in this Congress on alternative, affordable solutions. That's what the American people want, and that's what my constituents desire. And I would also challenge my friends on the other side of the aisle to listen to the American people and join our efforts to work towards better solutions to our nation's health care challenges.
Gentleman's time has expired. The gentleman from Massachusetts.
Madam Speaker, I yield 1.5 minutes to the gentlewoman from Texas, Ms. Jackson.
Gentlewoman from Texas is recognized for 1.5 minutes.
Thank you, Madam Speaker, and thank you to my good friend from Massachusetts for yielding. Let me say that the good news is that the only thing that occurred last evening was simply a vote, because the law of the land is still the Patient Protection and Affordable Care Act. And I hope that the President's words are not twisted, because I agree with him. We are all willing to work together to do the right thing, which is to amend a bill. I don't understand the understanding of my friends on the other side of the aisle. Repeal the law of the land has nothing to do with questioning some of the provisions. Frankly, They're not even listening to a distinguished doctor, Senator Frist, the former majority leader, who said this bill, our bill, is the law of the land, and it is a platform, the fundamental platform upon which all future efforts to make that system better for that patient and that family will be based. What is there not to understand? Amend the bill. Don't repeal it. In fact, Senator Frist said that if the bill was on the floor, he would have voted for it. I spoke to some students the other day, and they asked about doctors. This bill has in it scholarships for medical professionals, the bill that we have. And in fact, the issue, of course, is one that you cannot dispute. This bill saves lives, so much so that the Republican majority leader ran to the media to promise seniors that they wouldn't lose the $250 that our bill, the Patient Protection Bill, guaranteed them so that they would have some cover, some cushion for their prescription drugs. So, my friends, I know we're doing the right thing. We're all willing to amend, but how ridiculous it is that you would repeal the law of the land or attempt to do so, and I know the President still has his veto pen because this bill will save lives. I yield back.
Gentleman's time has expired. Gentleman from California.
To one of our new members from Oklahoma City, Mr. Lankford.
Gentleman from Oklahoma is recognized for 1.5 minutes.
Thank you, Madam Speaker. Thank you for yielding your time. The repeated diatribe by members from the other side of the aisle that somehow they're the only individuals in this chamber that care about the health of American families demonstrates again the deep-seated partisanship that we must work to defeat. We all want great health care in America. We hear the American people loud and clear. They don't like Obamacare, but they do want something to be done. We must have real national tort reform to reduce the cost of defensive medicine. We must encourage medical innovation and deal with the FDA approval process that covers any new discovery and paperwork costing $1 billion a drug just to get it through the FDA process. We must open up more options for insurance carriers, allowing someone who's frustrated with their service, the cost or quality of their carrier, to fire them and to get a new insurance provider. We must reject price fixing as a cost-cutting solution. We must allow every American to choose their own doctor, even pay their doctor directly if they choose to do that. We must give senior Americans more choices in physicians who accept Medicare patients. We must provide states with greater flexibility, and we must deal with portability, high risk, and pre-existing conditions. Republicans have friends and family that are dealing with the same medical issues that Democrats deal with. Suffering, disease, and pain have no respect for political affiliation. We just believe that if you're sick and hurting, you should contact your doctor, not Washington, D.C., to see what to do next. Let's surprise America. Let's work together and let's get something done. Let's show them that even with a divided House and Senate, we can reject the gravitational pull of politics, we can put aside our differences, and we can work together for the good of those who are most vulnerable. I yield back my time.
Gentleman's time has expired. The gentleman from Massachusetts.
Madam Speaker, I yield myself 20 seconds.
Gentleman's recognized.
I just want to respond to the gentleman who just spoke. We hear these distortions over and over and over again. We heard them during the campaign that were perpetrated by my friends on the other side of the aisle and by their allies in the insurance industry, that somehow that what we passed was a bill that wouldn't allow you to be able to keep your own health insurance. That's just wrong. What we passed was a bill that actually provides competition and insures tens of millions of more Americans. I'd like to yield 2 minutes to the gentleman from Minnesota, Mr. Ellison.
Gentleman from Minnesota is recognized for how many minutes? 2 minutes.
Madam Speaker, repeal and replace? Well, what about protect and improve? What about improving the bill that is there right now rather than repealing and replacing? You know, the fact is the Republican caucus is talking about replacing a bill, and yet whether it's whether it's pre-existing conditions or filling in the donut hole, I've heard several of them say, oh, we want to keep that, but yet they don't want to protect and improve. They just want to repeal. Why? To protect the insurance industry. I can't see any other reason why they are doing this. The Affordable Care Act is a good bill. And can it be better? Of course it can be better. But that's not what we're talking about doing today. We're talking about taking away benefits that Americans have in their hand. The Republican caucus is snatching away people who want to get their children on their health care insurance who are under 26 years of age. Snatching away free preventative care for seniors. Snatching out of the hands of families whose children are trying to be able to get care who may have a pre-existing condition. snatching out of the hands of seniors who are filling in the donut hole. They are taking away a benefit Americans have right now, and this is wrong, and it's a shame. The fact is, the Democratic caucus, when we had the White House and the both houses of Congress, within 2 years, we brought to the American people a health care bill. When the Republican caucus has the House for 6 years, between 2000 and 2006, they don't do anything other than do a big, fat giveaway to pharma. And so this is what we get.
Yield on that point. Will the gentleman yield on that point? Would the gentleman yield?
I think I'm out of time. Otherwise, I would, but I'm out of time.
Would the gentleman yield?
On your time? I mean, I'm out of time.
Gentleman from
Did
California.
I don't have any time.
Gentleman,
Madam Speaker?
I'll yield time I don't
myself
have.
15 seconds. I
gentleman
yield
from
myself 15
California.
seconds.
Gentleman
have
from
any time.
California is recognized. Gentleman's time has expired.
So the gentleman's time did expire, and I yield myself 15 seconds, Madam Speaker, just to say, as I'd said to my friend earlier, it's interesting that they continue to say that we did nothing. Associated health plans, which Democrats and Republicans like, designed to drive down the cost for small businesses to provide health insurance, was submitted from this Republican House to the other body. The Democrats, in fact, killed that measure. So attempts were made to put into place real reform. And with that, backed by popular demand, the Rules Committee member from Lawrenceville, Georgia, for 2 minutes, Mr.
Gentleman
Woodall.
from Georgia is recognized for 2 minutes.
Thank you for yielding, Mr. Chairman. Thank you, Madam Speaker. I return to the well because I wonder if folks have the same small business people in their district that I have in my district. I wonder if folks are doing the same listening in their district that I'm doing in my district. We are here today to respond to exactly what folks have been asking for. Now, to give credit where credit is due, last year, before the last Congress expired, Democrats and Republicans came together to extend for 1 year. I would have liked to have seen it extended longer, but to extend for 1 year the tax cuts that our small business men and women were demanding. But the second part of the indecision that was there in the small business community, of the anxiety that was there, of the uncertainty that was there, is what's going to happen with my health care cost? What's going to happen with the health care plan? Now, we have not solved that. We have not solved that anxiety. We have not solved that indecision because we've only gotten one half of it done. We've gotten it passed in the House, but we've still got to take it to the Senate, and we've still got to take it to the White House. Now, again, in the spirit of giving credit where credit is due, I told folks throughout my campaign that I thought the President identified exactly the right two health care challenges: rising costs and access, and then came up with exactly the wrong solutions to those problems. Now, we talk about what's going to happen to folks when the donut hole change goes away. Well, did we have a chance last year? And I'm new to Congress. Did we have a chance in the last Congress to vote on that standalone donut hole closure? I don't believe we did. Did we have a chance in the last Congress to vote on the standalone pre-existing condition solution? I don't believe we did. Did we have a chance in the last Congress to talk about kids under the age of 26 and what they can do? We did not. But you know what we do? We have this resolution today that is going to give us for the first time, the opportunity as a nation to vote on those provisions one by one, because the only option Congress had last time under Democratic leadership to vote for a donut hole solution, to vote for pre-existing condition solutions, to vote for insurance for kids under the age of 26, was to do it with the unconstitutional mandate, $1 trillion in new spending, and hundreds of new bureaucracies. Madam Speaker, I yield back.
Gentleman's time has expired. The gentleman from Massachusetts.
Madam Speaker, I yield myself 20 seconds.
Gentleman's recognized.
I will remind the gentleman, because he's on the Rules Committee with me, that we could have had a chance to vote on all those things individually. And in fact, he did have a chance to vote as to whether or not we could vote on them individually on the floor. But he and other Republicans in the Rules Committee voted each and every one of those protections down. They voted against protecting people against pre-existing conditions. They voted against people protecting people on the donut hole. They voted against allowing people to stay on their parents' insurance up to 26. They voted against everything.
Gentleman's time has expired.
Would the gentleman yield?
The gentleman's time had expired.
Madam Speaker, I'd like to yield 30 seconds to our Rules Committee colleague in the name of comedy and civil discourse to respond.
I thank the Chairman.
The gentleman from Georgia is recognized for 30 seconds.
Madam Speaker, I would just say to my friend that I absolutely voted no on every single one of those Rules Committee amendments in the name of repealing the bill yesterday, and now today I have returned to speak in favor of this resolution so that you can work with the committee leadership to bring each and every one of those provisions to this floor for a vote, again, for the very first time. For the very first time, and I'm glad to support you in having that opportunity, and I'm pleased to be here in support of this resolution today. Thank
Gentleman
you.
yields back. The chair must ask members to bear in mind the principle that proper courtesy in the process of yielding and reclaiming time and debate, and especially in asking another to yield, helps to foster the spirit of mutual comedy that elevates our deliberations over and above mere argument. With that, the gentleman from Massachusetts is recognized.
I yield. I reserve the balance of my time.
Gentleman reserves the balance of his time. The gentleman from California.
Madam Speaker, may I inquire of my friend if he has any further speakers?
I'm the final speaker.
Madam Speaker, with that, I will reserve the balance of my time.
Gentleman reserves the balance of his time.
Madam Speaker, may I inquire how much time do I have left?
Gentleman from Massachusetts has 4 minutes remaining.
Okay. Madam Speaker, I want to amend it. I have one additional speaker. The gentleman from Virginia, Mr. Moran, would like to be able to speak for 30
You mean
seconds.
the gentleman told me that he was a closing speaker, and now he has one additional speaker? Good heavens, I mean, what is the world coming to?
I was misinformed.
Gentleman from Virginia is recognized for 30 seconds.
Oh, I appreciate the lenience of the Chair of the Rules Committee. I thank my very, very good friend from Massachusetts as well. What troubles me with this debate, and I would particularly address myself to my colleagues on the other side of the aisle, is that we took 2 votes yesterday. One was to provide coverage for ourselves. The next, really, to deny it to our constituents. That I find troubling because we all have the right for guaranteed coverage regardless of pre-existing conditions. We have a choice of easy-to-compare health insurance plans. We have coverage for early retirees. Women have equal premium coverage. We have access to affordable care, low-cost preventive service, all of these things
Gentleman's
for
time
ourselves,
has expired.
but then voted to deny it to our constituents. I find that troubling. Thank you.
Gentleman's time has expired. The gentleman from California.
Thank you, Madam Speaker.
Does the gentleman from California seek recognition, or would the gentleman
No, I don't seek
continue
recognition.
to reserve the balance of his time?
I will continue to reserve the balance of my time,
Gentleman
Madam Speaker.
reserves the balance of his time. Gentleman from
Thank
Massachusetts.
you. I yield myself the remaining time, Madam Speaker.
Gentleman is recognized for 3 1/2 minutes.
Madam Speaker, what is before the House today is this is not a serious legislative effort. It's a series of sound bites that mean nothing. Committees don't have to do anything. Speaker Boehner is quoted in the Hill basically saying that he's not going to hold any of these committees accountable. They can do it if they want to, whatever. If they don't, so be it. And what we're dealing with here today really is kind of a political ploy, not a serious legislative effort to replace anything. You know, my friends on the other side of the aisle have got up over and over and over again and said, well, you know, we're really with you on pre-existing conditions. We're really with you on the donut hole. We're with you on allowing parents to keep their kids on their insurance until they're 26. But yet, they're really not. Because if they were, they wouldn't have voted yesterday to repeal all those protections. And if they were really with us, then we would be talking about today coming to the House floor with a series of initiatives that would actually continue to protect those benefits for consumers. But they voted to repeal all of that. And I want to know, how can anybody in this House, how can anybody, in light of the protections that have been put in place, go back to an individual who has been who's now able to get health insurance because we prohibited insurance companies from discriminating against them for pre-existing condition? How can you go to them and say, well, we're going to change our mind. We're not going to do that anymore? How do you go to senior citizens who are struggling with that donut hole, and we've begun to close it? How do you go to them and say, we're going to raise your taxes? And how do you do that? How do you go to a parent whose child can remain on the health insurance because we've extended it to allow them to stay there until they're 26 and say, well, that doesn't matter anymore? It just doesn't make sense. That's not what people voted for in the last election. They didn't vote for you to repeal all of those things. What they voted against was this distortion of a health care bill that you put out there, my friends on the other side of the aisle, that was very well funded by the most expensive advertising campaign funded by the insurance company in the history of our country. This distortion out there, yeah, I mean, everybody was against that distortion. That is not the reality. And as the months have gone by and as the reality has become clear to people, as they have seen the benefits and the protections, as people have been able to wrest control of their health care from the insurance industry, as the consumers realize they have more and more rights, as there are more and more protections that are built into law to protect people of all ages, people say, well, we don't want you to change that. We want that to be saved. And I'll just say one thing. When my friends say, well, we could just do a little bit of this and a little bit of that, you really can't, because it's kind of like a domino effect. Everything has an impact. So this is a serious debate, and if there's some indignation on this side of the aisle, it is because we know that this is a big deal, and real people, you know, who have real challenges affording their health care and dealing with the complexities of the health care system and the inequities of the health care system are now getting some relief, and they will be hurt by what you are doing. So let's be honest here. What happened yesterday was my friends on the other side of the aisle went on record as saying we're against everything. Today, we're going to pass a resolution, I guess, that doesn't do anything, doesn't even require committees to do anything, but just says we're for all these nice feel-good sound bites. That's not a serious legislative effort. That's why people are cynical. We can do better. I urge my colleagues to vote no on this.
Gentleman's time has expired. The gentleman from California. Gentleman's recognized for 8 minutes.
Madam Speaker, there was a very powerful and resounding message that came last November 2nd, and that is the imperative for us to create jobs and get this economy growing. The American people are hurting. In my state of California, we have a 12.5% unemployment rate. Part of the area that I represent has a 15.5% unemployment rate in the Inland Empire in Southern California. It is essential that we focus our attention on creating jobs. And I believe that the step that we're taking today is going to be very, very important as we pursue that goal. Now, why is that? When we look at what passed last year, was signed last March 23rd by the President, it was a measure that imposes mandates on small businesses, jeopardizing their ability to hire new workers. It's a measure that imposes dictates on doctors, a regulatory structure which undermines their potential to hire new employees. It is a measure which, in many ways, jeopardizes our potential to grow the economy because it is a dramatic expansion of the entitlement programs which Democrats and Republicans alike say need to be addressed if we're going to create jobs and get our economy back on track. You know, one of the things that I think is important to note is that people have said that repeal of the health care bill, in fact, is going to cost $230 billion based on those CBO numbers that came out. Well, only in Washington, D.C. can one cut a $2.7 trillion expenditure and have it labeled as a cost, Why is it a cost? It's a cost because the measure that was signed last March 23rd imposes a $750 billion tax increase on working Americans. Now, what does that do to create jobs and get our economy growing? Obviously, it undermines our shared priority of creating jobs and getting our economy back on track. We know that with the $14 trillion national debt that we have and deficits down the road, we need to do what we can to rein in that spending, tackling entitlements, and dealing with issues like the one that we're facing today. Now, having said that, we all know that Democrats and Republicans alike want to ensure that every single American has access to quality, affordable health insurance so that they can have access to quality health care. And I underscore the word quality because if one looks at the important research and development that takes place in the United States of America, I believe that the measure that was signed last March 23rd and that we voted in this House to repeal yesterday, that measure undermines the very important pursuit of research and development to deal with many of the diseases that are out there. So, Madam Speaker, I've got to say that we all say that we want every American to have access to quality, affordable health care. And everyone has acknowledged that that bill that was signed last March 23rd is in fact flawed. In his news conference right after the election, the President of the United States said that he believed that we need to address the so-called 1099 provisions that impose, again, an onerous mandate on small businesses, undermining their ability to create jobs, exactly what I was saying earlier. I quoted the distinguished assistant minority leader, the former majority whip, Mr. Clyburn, who on a program earlier this week said, Republicans and Democrats need to work together to rectify some of the problems that exist with this measure. And as I said, it was 2 days ago that the President of the United States wrote his editorial in which he talked about in the Wall Street Journal the need to reduce the regulatory burden that is imposed on the private sector so that we can get our economy going and create jobs. And he also said on that same day that he is willing and eager, Madam Speaker, willing and eager to work with Republicans to rectify some of the problems that exist in this measure. Now, I heard my friend Mr. Matheson this morning on National Public Radio state that there was not a plan out there, and that's the reason that, having voted against the bill, he did not vote for repeal, because there's not a plan out there. I heard that at 7:35 this morning on WAMU. And Mr. Matheson made that statement, but the fact of the matter is, unlike the plan that was signed into law on March 23rd of last year, that did not include the kind of bipartisan participation that we believe is essential, I've got to say that we are planning to proceed with this direction to the 4 committees that will allow virtually every member of this House to be involved. We have 12 items, and I'm happy to say that under this rule we have made an order, Mr. Matheson's amendment that we'll be considering in just a few minutes, that will add a 13th item to deal with the so-called doc fix. So that, again, underscores our desire to work in a bipartisan way to address some of the concerns that are there. Now, what is it that we say need to be done? And frankly, the President of the United States has indicated some of these he supports. We need to make sure that people do have a chance to purchase insurance across state lines, which is now under McCarran-Ferguson denied. We need to make sure that we put into place associated health plans, again, a provision that passed a Republican House but was killed by Democrats in the Senate when we last were in the majority. We need to do everything that we can to allow for pooling to deal with pre-existing conditions. We need to make sure that we expand medical savings accounts that provide incentives for people to put dollars aside to plan for their health care needs. And one of the things that the President of the United States said in his State of the Union message 1 year ago, right here in this chamber, we need to deal with meaningful lawsuit abuse reform so that we can have attention focused on patients and doctors and not on trial lawyers. So I would say to my friend from Utah, those are 5 items that are part of our plan that I believe can enjoy strong bipartisan support. And so, Madam Speaker, I urge my colleagues to support HRES 9 so that we can proceed with a bipartisan consideration of this very important goal that we share of creating jobs, getting our economy back on track, and ensuring that every single American has access to quality, affordable health insurance. With that, I yield back the balance of my time.
Gentleman yields back. All time for debate has expired. For what purpose does the gentleman from Utah seek recognition?
Madam Speaker, I have an amendment at the desk.
Clerk will designate the amendment.
Amendment printed in Part B of House Report Number 112-2, offered by Mr. Matheson of Utah.
Pursuant to House Resolution 26, the gentleman from Utah, Mr. Matheson, and a member opposed, each will control 5 minutes. The chair recognizes the gentleman from Utah.
Thank you, Madam Speaker. I'll yield myself as much time as I may consume.
Gentleman's recognized.
Madam Speaker, I rise today to offer an amendment to H. Resolution 9. I did not support wholesale repeal of the legislation, but I do believe there are some bipartisan improvements that could be made to the existing law. And I think now's the time for all of us in Congress to roll up our sleeves and work together. The goal of this amendment is pretty straightforward. It is set up to maintain adequate health care service, to stabilize the business practice of doctors, and to take into account the long-term economic health of this country. We all agree that the doctor-patient relationship is a fundamental part of quality health care. But we have found that we have a flawed formula when it comes to setting reimbursement levels, and every year it threatens the ability of doctors to care for patients, and it threatens the ability of patients to see their doctors. And members of Congress on both sides of the aisle and stakeholders throughout the health care community, physicians, senior citizens, they've all recognized that we have a flawed policy. How many times in the past have we come together in a bipartisan way over the years in the House of Representatives to provide a temporary patch to this problem without fixing the underlying problem? In 2010 alone, Congress took 5 different votes to delay a scheduled cut without stepping up and dealing with the permanent fix to the problem. By an overwhelming vote just a few weeks ago, Congress supported a 1-year delay to a looming 25% cut in physician payments. My amendment is very straightforward and clear. It adds an additional instruction to the committees of jurisdiction over health care legislation to replace the flawed sustainable growth rate formula used to set Medicare payments for doctors. And it requires that Congress adopt a permanent fix to what has previously been an ongoing problem. It's the right thing to do on behalf of doctors and patients. It's the right fiscal policy as we look for ways to make health care funding more sustainable and more predictable. And as we begin the year looking towards improvements in this extremely complex and yet highly personal and important issue of health care, I think that adopting this amendment would be a good step to move in that direction. I ask all my colleagues to support this amendment in a bipartisan way. I'll reserve the balance of my time.
The balance of his time. First, the gentleman from California.
Madam
Rise.
Speaker, I'd like to claim the time in opposition to the Matheson
Gentleman is
amendment.
recognized for 5 minutes.
Thank you very much, Madam Speaker. And I claim time in opposition to the amendment to say that I support the amendment, Madam Speaker. I believe that as you look at the list of 12 items that we have in HRES 9, they are not to be limited at all. And I think that by virtue of our making the Matheson amendment in order to deal with the so-called doc fix issue, we have made it very clear that we are already beginning at this juncture to work in a bipartisan way in our quest to create jobs, get our economy back on track, and ensure that every single American has access to quality, affordable health care. And so this is, again, the beginning of a very important process. And I'm very pleased that Mr. Matheson has been able to play a role in fashioning HRES 9. And, Madam Speaker, I hope very much that with the President of the United States saying that he is willing and eager to work with Republicans to rectify the problems that exist with the past health care bill, and the fact that Mr. Clyburn, the Assistant Minority Leader, has said that he wants to work in a bipartisan way to deal with these issues, will lead to strong bipartisan support for Mr. Matheson's amendment and for the underlying resolution. And with that, I yield back the balance of my time.
Gentleman yields back the balance of his time. Gentleman from Utah.
How much time do you want? Do you want 1? I yield 1 minute to my colleague from New Jersey, Mr. Pallone.
From New Jersey is recognized for 1 minute.
Right here.
Thank you, Madam Speaker. I rise in support of Mr. Matheson's amendment. I do want to point out, though, that the Democrats, when we were in the majority, many times tried to pass a permanent fix and did not receive support, I believe, for many Republicans, except I think in one case we did have Dr. Burgess's from Texas support. And back in November of 2009, we passed a permanent fix, a doctor's fix. But because we could not get any Republican support, any real Republican support, we had to continue to rely on short-term fixes. We did, however, as you know, at the end of the last session, pass a 1-year fix, which is in effect now. But I do think that this is a very commendable response that Mr. Matheson has, and I certainly intend to support it. But the difficulty is that the many years that when the Republicans were in the majority, they had the opportunity to pass a permanent fix and to deal with this issue, and they always kicked the can down the road and then did not cooperate with us on a bipartisan basis when we were in the majority to try to achieve a permanent fix. I certainly intend to work with the Republicans to do that, but they are the reason we don't have it now.
Gentleman's time has expired.
Speaker.
Gentleman from California.
Madam Speaker, I was mistakenly under the impression that the gentleman from Utah had exhausted his 5 minutes, and so I'd like to reclaim the remaining time that I have without...
Is there objection?
Thank you, Madam Speaker. With that, I reserve the balance of my time.
Gentleman reserves the balance of his time. Gentleman from...
I have no further speakers, so I again want to thank the opportunity to have this amendment considered, urge support of all my colleagues, and I'll yield back my time.
Gentleman reserves. The gentleman from California.
Thank you very much, Madam Speaker. As we know under the structure, I have claimed time in opposition to the amendment, but I will state once again that I am supportive of the Matheson amendment, urge my colleagues, Democrats and Republicans alike, to come together and vote for adding what will be item number 13, which will be the beginning of wide-ranging reform to ensure that every single American has access to quality health insurance so that we can, again, get our economy back on track and focus on job creation and growth. And with that, I again urge support of the Matheson amendment and yield back the balance of my time.
Gentleman yields back. Gentleman from Utah?
As well.
Gentleman yields back as well. Pursuant to House Resolution 26, the previous question is ordered on the amendment and on the resolution. The question is on the amendment by the gentleman from Utah, Mr. Matheson. Those in favor say aye. Those opposed, no. The ayes have it.
Speaker,
Gentleman
on that,
from
I ask for the
California.
yeas and nays.
The yeas and nays are requested. Those favoring a vote by the yeas and nays will rise. Sufficient number having risen, the yeas and nays are ordered, and members will record their votes by electronic device. Pursuant to Clause 9 of Rule 20, the Chair will reduce to 5 minutes the minimum time for electronic voting on the question of adopting the resolution if that question arises without intervention of a motion to recommit. This is a 15-minute vote.
So for the third day this week, health care back on the floor, on the agenda for the U.S. House. Last night passing the repeal bill by a vote of 245 to 189. Today dealing specifically with a resolution that would move it forward to the committees. It would require 4 House committees to report back legislation to the House on specific changes to the current health care law. Our specific focus on phones as we enter this first 15-minute vote, the first of 2 votes here, is to ask you, what is your priority in terms of health care? Would you like to see the bill repealed? Keep in mind that repeal yesterday was just passed in the House, and Senator Reid says it won't come to the Senate floor. Do you want to see it repealed, or do you want to see it replaced, pieces of it replaced or improved item by item? The numbers are on your screen. For Democrats, it's 202-585-3885. Republicans, 202-585-3886. Independents and others, 202-585-3887. Make sure you mute your television or radio when you call in. And if you have called C-SPAN in the last 30 days and gotten on the air, give others a chance to call in this morning. 2 votes here. This first one is the 15-minute vote on the amendment proposed by Democrat Jim Matheson of Utah, which would deal with the replacing the Medicare payment formula for doctors. And the next vote will be final passage on H.R. 9, the resolution directing the 4 committees of the House on health care. Let's go to phones first here. Van Nuys, California, and Cynthia on our Democrats line. Hi.
Hi. I just wanted to call in and give my opinion about what I think that the Republicans are doing this week with the repeal bill. I do feel there need to be some changes and upgrades to the current bill, but I believe the Republicans are wasting a lot of unnecessary time. I believe they should be trying to target the current bill and the things that should be addressed in the current bill, and not be just trying to get rid of the whole bill without anything to replace it. There have been millions of people right now that are benefiting from this bill, and so I just wanted to, share my opinion about that.
Let's hear from Republican Dean in Raleigh, North Carolina. Hi there.
Good morning. Yeah, I think the bill does need to be repealed, but I agree with the lady that was just on that there are some good parts of the bill. I'm a senior citizen myself, and the health and the drug part is a good revision. So I would like to see it reworked and come up with the parts that are good, but to eliminate a lot of those 1,200 pages or whatever it was that they never really got to read and to vote on.
Associated Press writes that Republicans say there's no timeline for their, quote, replace legislation, but if they're serious, they'll have to start advancing specific proposals by the summer. The likeliest prospect, writes AP, Republicans have for success in the short term lies in taking on the 1099 tax reporting requirement for businesses. It's been widely criticized as a paperwork nightmare. Even the White House wants to scrap that provision. That's from the Associated Press. To the Independent line, Sandusky, Ohio. Hi to Jim. Jim, you're on the air. Go ahead.
Oh, yes. I'm just calling to, like some of the other people have commented already, that I'd like to see some of this stuff kept, and then, the stuff that's no good, scrap it.
Well, what do you like most about what was passed last year and signed by the president? What is the one thing in there that you got to keep?
Well, I think pre-existing conditions, because people were born with illnesses, so they shouldn't be penalized because they're born with a certain illness. It's like myself. I'm on kidney dialysis, and with my medicine and my dialysis treatments, it runs over $400,000 a year. I can't, if it wasn't for Medicare and Medicaid, I wouldn't be able to afford to pay $400,000 a year.
Thanks for calling in, Jim. Reading, Connecticut is next, and Reading, Connecticut, Jennifer on our Democrats line.
Hi, thanks for taking my call. I'd like to echo the opinions of many people, maybe a great number in this country, that the Republicans are wasting time. The people voted in November not to repeal health care because it's such a benefit for so many, including Republicans. They voted to get jobs because the unemployment rate is high and ridiculously high, and if they could take their time now and focus on that rather than this conundrum, it's just going nowhere. Why are they doing this? It makes no sense. The law they have now, a lot of it is wonderful. They tweak it. The 1099 paperwork snafus. Work that out. But don't try to unload everything. It just makes no sense to me and to many of the people because it's ridiculous.
This will be the last day of work this week for the U.S. House. They've been working on health care the past 3 days. Again today, H.R. 9 would require 4 House committees to report back legislation on specific changes to the current health care law. The vote now is on an amendment by Jim Matheson of Utah dealing with replacing that Medicare payment formula, that growth rate formula that you've heard debated many, many times on the House and Senate floor. We're taking your phone calls. The U.S. House is out tomorrow, and Democrats head to their weekend retreat. Republicans had theirs last weekend in Baltimore. Here's Keansburg, New Jersey. John's a Republican there. Go ahead with your comments.
Yes, I'm calling in because I know that it's the right thing to do to repeal this because the Republicans had no say-so whatsoever in this bill. Secondly, there is a way to pay for health care in this country and to eliminate the debt. And one of the reasons I say this is because we can start a lottery throughout the country and pay for everyone's health care. Why isn't anybody thinking about these things?
Tacoma, Washington, next up, Independent line. David, hi there.
Hey, how you doing? I just wanted to say I went and called my Senator Cantwell.
Yeah.
And I brought up the fact that there's been lots of legislation over the years about health care. Instead of going back and fixing those, they want to add more. All it's doing is putting bad legislation on top of bad legislation. So why don't they go back and fix all the bad stuff instead of adding more?
The repeal vote yesterday passed on a party line vote, pretty much 245 to 189. There were 3 Democrats, Representatives Dan Boren of Oklahoma, Mike McIntyre of North Carolina, and Mike Ross of Arkansas, who opposed the law last year. They joined the 242 Republicans supporting that. The vote was 245 to 189. Palm Coast, Florida, next up. Mary's on our Democrats line.
Yes, I worked as a hotel housekeeper until I turned 65, and in my 50s and 60s, I had to buy my own insurance from Blue Cross Blue Shield, and every year they raised my premium so high, it stressed me out. I finally called one day and asked, why are you raising my premium so ridiculously high? They said it was because of people who had no insurance and used the emergency rooms for their medical care. That's why I believe the mandatory insurance is practical. It would level the playing field, bring down premiums for everyone, and it would also take financial pressure off hospitals who, the reason they charge so much is to compensate for people who come in and use the emergency room.
And there are lawsuits. There are 2 lawsuits that are advancing in the federal courts, of course, that a number of states challenging the constitutionality of that mandate, that so-called mandate that was part of the health care law. We're taking your phone calls on your thoughts on the moves this week to repeal the health care law and the debate today on changes to specific parts of the current health care law. The numbers are 202-585-3885 for Democrats, Republicans 202-585-3886, Independents 202-585-3887. We'll continue taking your phone calls through this vote. A reminder, this is a vote on an amendment by Jim Matheson of Utah on the Medicare payment formula. Republican Brian in Harris, Oklahoma. Hi there.
Yes. How are you doing this morning?
Just fine, thank you.
I'd just like to say, you know, we as Americans need to understand that this whole health care bill was passed, 2,800 pages, really with no bipartisanship. You know, it was behind closed doors. You know, I understand there's pros and cons to each side, but we just really need to understand as Americans, we've got to do something to get us back on top again, to reduce our debt, and, you know, try to work together. And that's just really what I wanted to say.
Prosperity, South Carolina, independent line. Otis, go ahead.
Hey, thank you for this forum you have, and I appreciate you giving me the chance to speak my piece. I like what they're doing right now. They should have been doing this last year. They should have had both sides of the House in there and started, you know, debating on the pros and cons of the whole bill. I'm for keeping the bill as it is, but I'm also like the way they're doing exactly right now. They're wanting to, you know, fine-tune the thing. That's what we need, to fine-tune it. I just wish somebody would put the amendment in there for us to be able to have the government give us a chance to buy insurance from them based only on, you know, a person's amount of money that they earn during the year. A means testing, in other words. So I wish somebody would have put that in there, because if they're taking Medicaid out of my check now, why can't they take a weekly step it out of my check for health care? Because that's what I want. I don't want to, I mean, the insurance companies, they keep going up on their premiums, and they have to, some, because of the cost. Because recently I was in the hospital for an accident, and just 1 week in the hospital was over $46,000 just for the room.
Who's your insurance through there, Otis?
This was a job-related insurance.
I see.
And it was workers' comp.
How you doing now? You okay?
I'm doing fairly well. I'm still having to go through physical therapy to get my body mended back up to where I can go back to work. But if my boss man hadn't had that insurance through the state, because that's, you know, the workers' comp.
Yes.
He would have been faced with these bills as much as I would have been faced with these bills. And I know just for 1 week in the hospital, just for the room itself was $46,000. This wasn't for all the specialists that had to see me, or the x-rays, the medications I had to have, and all that.
Otis, thanks for weighing in. We hope you feel better. On the medical side of things, we did want to let you know that there's a briefing coming up today in Tucson on the status of Representative Gabrielle Giffords, who's expected to be released from the medical center there in Tucson on Friday. We'll find out more at noon Eastern. We will have live coverage of that over on cspan.org. And while you're there, you can also find out information on cspan.org about the legislation proposed by the Republicans here, the H.R. 9, this resolution being voted on in just a moment here. and also the original Health Care Repeal Act, which passed yesterday by a vote of 245 to 189. We're also covering today, it was on C-SPAN 3, the House Judiciary Committee met earlier today on medical liability issues, and that is underway. You'll be able to see that later in our schedule as well. Next up, we go to Louisville, Kentucky, and Melissa on our Democrats line.
Hi, my name is Melissa. I pray that they do not repeal this health care plan, because I think as time goes on, it will work its way it's out. And I think more and more people are seeing this. And as far as the Republicans last year, they said it was behind closed doors, but the Republicans still did not want to have anything to do with health repeal or anything like this, or a health, agreement on anything. And also, I was listening to the lady. One more thing. I don't, for the past 12 years, I have had Federal Blue Cross and Blue Shield. I call it Federal, but it's Blue Cross and Blue Shield. Every single year, my insurance has gone up. So they can't blame anything now that the insurance companies are going to go up, the prices are going to go up or anything, because this has been going on for years.
Typically, how high, what's the percentage of increase in your insurance year after year?
Oh, every year it goes up at least $20 to $30,
Thanks for sharing that, Melissa. We go next to Vicki in Raleigh, North Carolina, Republican line.
Hi, how are you today?
Fine, thanks.
I have been listening to this discussion back and forth for the last 3 days, and it just seems like everybody is saying the same thing over and over and over, and it's only about 6 or 7 items that everybody's worried about. I don't understand why the health care bill cannot be thrown out and start over. 2,900 pages is a lot. I don't know how anybody could understand the whole bill to start with, because it's so big, and we don't know what kind of earmarks are in it or anything.
So Vicki, if you think it's kind of 6 or 7 items that need to be dealt with, you would rather see it start from scratch, repeal it, and start from scratch, correct?
Yes, sir. And the Democrats keep saying that your insurance is not going to go up, your insurance is not going to go up. Well, ours has gone up. I mean, it went up approximately $2,500 for the year, and our copay went from $35 to $75. And also my daughter's went up quite significantly, and now my granddaughter cannot even go to the doctors that she's been seeing since she was just a small child, and she has a condition that she really needs to stay with her doctors.
This first 15-minute vote winding down, this is the Matheson Amendment dealing with the Medicare physician payment rate, and then the next vote, 5-minute vote on final passage on a bill that, here's how the Washington Times describes this resolution. It would dole out to committees the responsibilities of carving out an alternative bill that, among other things, reforms the medical malpractice insurance system, provides access to affordable health care coverage to people with pre-existing conditions, and prohibits taxpayer-funded abortions. The Washington Times on today's debate, which is wrapped up on H.R. 9 and final passage coming up shortly. Here's Beaver Dam, Virginia. Bill on our independent line.
Oh, yes, Bill Danner. I think what's going on here is quite good. What we're seeing now, in that, of course, what was repealed yesterday was the bill, but it can't go on from here to the Senate or to the President. So it's repealed at the House level, and of course that allows them now to rewrite it at the House level.
Mm-hmm.
And I think it's wonderful what we're seeing now, in that Matheson of Utah, who's a Democrat, has put an amendment on, and now what we're seeing is that Democrats now are gathering on and voting with the Republicans on this amendment. And hopefully now what we'll see is that Democrats will help out with this, as they're being asked to by the Republicans, to become partisan with this and rewrite this thing, you know, in committee. And when this gets completely rewritten, then it will be offered up as a replacement bill. And at that time, it will be voted on as a replacement bill and replace, because that's when the replacement bill will come in. You can't replace the bill until you have something to replace it with.
Bill, thanks for those comments. And as he pointed out, too, this is a Democratic amendment. Jim Matheson of Utah. Here's Houston and Troy on our Democrats line. Hi.
Thank you for taking my call. I just wanted to say, with the health care law that's in place right now, you can see that the country is basically split. You know, so when Republicans say the overwhelming majority of Americans don't want this bill, that's not true. It's 50-50. Now, what they're doing is they're repealing the law that's in place. That's what they promised their constituents they would do. But to me, it made no sense that you had over a year and know that this is what you were going to do, but yet when you finally take over the House, you don't have a replacement bill in place. You say, well, we're going to try and craft something. The smart and sensible thing for them to do is say, this is what we're replacing this Obama health care law or bill that they had. This is what we're replacing with it right now. So you can piggyback on what you're trying to do and say we're repealing this and show the American people this is what our answer is. But they didn't do that because I really don't honestly think this is what they want to replace this bill. That's my honest opinion. They controlled the White House and the Congress for 12 or 16 years, and the only thing they did was do a prescription drug bill that wasn't paid for. So they don't plan on doing anything with health care. It really just irks me that this is just a big front to just appeal to their base, and that's all I got to say.
Well, echoing Troy's view, the Hill newspaper in their blog that covers the House debate writes that Representative Jim McGovern of Massachusetts said during the debate, quote, it's a series of talking points, it's a press release. Instead of repeal and replace, it's repeal and relax. They also said that Representative Anthony Weiner pointed out this morning that HRES 9 does not assign any deadlines for coming up with health alternatives, pointing out the Democrats' fear that Republicans may never develop their own health care plan. Weiner argued that Republicans do not seem to have any plan at all to improve health care at this point and exclaimed, quote, I will eat this rostrum if they follow through. That's from Anthony Weiner, quoted there in the Hill in their Floor Action blog. Just a couple of more votes left, but let's see if we can get a couple more calls to our Republican line to Idaho, Ankeny, Idaho, and this is Brenda?
Yes.
Hi, go ahead.
Hi. It's Ankeny, Iowa, IOWA.
My mistake. My mistake.
I just want to say I'm thrilled the Republicans are replacing this bill and they're going to fix it. They're going to put new things in, and because there are so many little things in this bill that people aren't aware of. For instance, did you know that in 2013 there's a little clause that kicks in that if you sell your house, you're going to have to pay a 3.5% tax on your house if you sell it? What's that got to do with health care? There are a lot of things submitted in this bill, 2,000 and however many pages there are, that are bad for this country. We need to repeal the whole thing and then debate what they're going to put in it and let them vote on it. Thank you very much.
Thank you. Ray's in Mississippi. Area, Mississippi, Independent Line. Hi.
How are you doing today? I've been listening to this, and I've been tracking government for all of my life. I kind of like it, and I'll have to tell you, health care has been long coming. It's been needed. Many presidents from Ronald Reagan on have tried to get it. It's finally here. Now everybody's whining and crying about what's in a 2,000-page bill. Obviously, many people in this country do not read books anymore because books are 500 to 1,000 people. In this country do not read books anymore because books are 500 to 1,000, 2,000.
That'll do it, Ray. Sorry, going to have to let you go.
The motion is adopted. Question is on adoption of the resolution. Those in favor say aye. Those opposed, no. In the opinion of the chair is the ayes have it. Gentleman from California.
Mr. Speaker, Pass for the yeas and nays.
Yeas and nays are demanded. Those in favor of the yeas and nays will rise until counted. Sufficient number having arisen, the yeas and nays are ordered. Members will record their vote by electronic device. This will be a 5-minute vote.
And vote on final passage on HRES 9. The resolution would require 4 House committees to report legislation back to the House on recommended changes to the current health care law. Again, this is a 5-minute vote and the last vote of the day, likely of the week as well, as the House will not be in session tomorrow. Democrats are heading off on their legislative retreat to the Eastern Shore of Maryland. Republicans had their retreat last weekend in Baltimore. On Capitol Hill today being January 20th, this is the 50th anniversary of the inauguration of John F. Kennedy as president, and there is a ceremony going on today at noon Eastern, and we will bring you live coverage of that from the Rotunda. You can follow that on cspan.org. The House is voting on HRES 9, a bill that would call on 4 committees of jurisdiction, Ways and Means, Energy and Commerce, Education and the Workforce, and Judiciary to report back legislation on specific recommended changes to the current health care law. This will be the last vote of the week, 5-minute vote on the House floor, and then they are done for this week. Reminder, the State of the Union is next Tuesday, and we will have live coverage of the State of the Union here on C-SPAN, also on C-SPAN 2. The Senate is out until next Tuesday.
This question, the yeas are 253, the nays are 175. The resolution is agreed to, and without objection, the motion to reconsider is laid upon the table.
Yeah, he's not ready.
House will be in order. For what purpose does the gentleman from Maryland, the distinguished